I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Does it look irritated?
No.
Honestly, not at all?
Not really, no.
So I'm going to get reception to call an ambulance, all right?
I was wondering if it might be possible to have a little wee for me.
That's so little.
I know.
That's too little.
I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Okay, here we go.
Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay, is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like, I don't want to leave the bed, I can't eat, I'm not happy.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't. Like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like, I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years. But right now I'm scared that it's only going to get worse.
Okay, all right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those? Yeah. Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder, because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay? Like you did today. If things don't improve, just give me a call.
Perfect. Thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Could barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that just had too much air in. I couldn't get it out.
So it just like, instantly I'm just like, I can't breathe.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better. And then, probably, I think, Friday last week, it felt not so good. And
How many puffs have you had today?
About 6.
Okay, I'm going to get you a nebulizer now so that we can talk a bit more, okay? You might need to come and sit here, Mum, so you're next to the... I can plug this in. All right, when ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. We're going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
A severe asthma
Yeah,
attack.
she's got respiratory rate of 60, despite a nebulizer tell them, so they need to come in now.
If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly.
Speaking, how can I help? What's your date of birth, please?
Vicky speaking, how can I help?
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again from what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, my lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days, despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon, okay? Thanks, guys.
No.
Thank you. All right, thank you, guys. Good luck. Take care. Poor Lord, she's just breathing. Oh, it's terrible. So fast. Really frightens me when they're that bad, because, anyway, poor love.
Relief in one sense when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Hi, how can I help? I've just been waiting a while now. Didn't know if you got me.
Yeah. So, because it was a medical emergency a while ago.
Yeah, you'll be
next. She just seen someone else. Sorry about the delay.
Don't worry.
Thank you so much. Bye. I can't decide if my headset's playing up or I'm speaking to a lot of deaf people today.
What do you think it is?
I think it's the headset. But then I speak to somebody else and
it's
everything's fine.
Yes. One of them wants to lose.
Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh,
Can I
very
have
good. A sticker? Yeah, you can have a sticker. For you. Even though you didn't have an injection, which one would you like?
Now, would you like a sticker?
No.
No? That usually works.
Come in. Sorry? Oh yeah, of course you can have a sticker. Look, I've got flowers, butterflies, cars, dinosaurs. Dinosaur one, I think that's a great choice. There you go. Can I have a high five? Very good.
Right. Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy, I know what the problem is. So, when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, OK.
But everybody else was in T-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or?
I'm okay.
You're okay, you're fine. Can I get your dad's take on things?
Yes,
See what he reckons.
Obviously, they saw him putting on a coat when everybody else was sweating, so they took his temperature and he was very hot.
OK.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success?
We have.
Oh, look at that. What I do is I just dip my little bit of paper. It's quite clever stuff, really.
Is that easy, isn't it, Dad?
Yeah.
It's easy being a doctor. OK, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated. Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Bye, Dad.
Okay, cheers, thank you very much.
Nice to see you, babe.
Thank you.
Take care.
Thanks a lot. Cheers.
Pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Does it sound any different if I talk to you on this?
I can't hear at all.
Ah. And you can hear me okay on this one?
Yeah.
Okay, thank you.
You're welcome. Antonio speaking, how can I help?
Hello, Miss Murray. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat, and then I have to go and pass a stall.
Yeah.
the pain that I get, it's like you're open, but you're not closing up. I don't know, like it hurts a bit.
But no bleeding from the back passage or anything like that?
No. It can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, Doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously you haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach. And that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
How's it going?
Kim, Erin, I would have said you've been so... You look like you two were kissing, then you turned around. Erin, like, she cool.
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
Been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky now.
Have you missed me?
Oh, yeah. Well, I miss you, but not coming around here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Oh, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That the only reason?
No, I like you as a
I was going to
person,
say.
And as soon as you got that colour...
using me for my blood technique.
Definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black. Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holidays yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see, like me, a healthcare assistant, a doctor and a nurse. So, and they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this. You know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them. So yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and
Oh,
comfort.
lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
Aaron speaking, how can I help?
Right, have a seat. What can I do to help?
I had some fertility tests last year and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist and he explained that I was kind of slightly below average but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
Okay. I've got a set of sperm results from the 1st of May.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist and give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean?
Okay. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance.
Of having a kid?
Yeah.
Okay.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yes, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all. One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So I had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially I was scared it might be an internal, but it wasn't. The bleeding was actually
from there.
From there.
Okay. So you've got here, you're seeing the Royal Marsden Hospital this Thursday, okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay. Oh.
And he's also going to have chemotherapy.
That's a lot.
Just a damn sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can be, especially at night time.
You're on the omeprazole, the propranolol,
Yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or of my bum.
Oh, John.
I did. So I quickly learned how to swallow.
As an alternative, a third option, you could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets, you're okay swallowing
absolutely.
them. You can make them a little bit stronger if you want.
Just slightly stronger.
Slightly
if possible.
stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No.
Yeah.
my sister, and one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away. Do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely.
Yeah.
If Charles was happy with
Absolutely,
it.
Absolutely.
And you have...
Absolutely, of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell, she sounds, and you need to...
Yeah.
You need to go over, and if you've got somebody... Not the child you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help.
Patient.
You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very unrecognised role across the UK. They estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And I know
good Lord, I've got a lot to do yet. Right, but we won't
Sorry,
take
so-
any longer. Thank
Okay,
you
no,
for
not
much
at
for your
all.
time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
We
great.
could do that.
Yeah.
and then,
That's very kind
but
of you.
anything in the meantime, I'm
You're
happy
so
to speak on the phone.
kind.
No, at all.
Thank you very,
At all.
very much indeed.
No, okay. All right, bless you. Oh. Okay.
Thank you.
All right.
Thank you for all your kindness.
No, you're very welcome.
Take care. See you
You
soon.
take care. So, okay.
Bye now.
Bye-bye.
Bye-bye.
All right.
Vicky, I'm going to win the lottery, okay? I just thought I'd tell you.
Just in case you do, I just want to let you know how much I like you.
Who are you?
If you feel you need to be seen, and I can arrange for an on-call doctor to call you. If they need to see you, they will arrange a time for you to come in.
Perfect.
To practice.
Yeah, practice it in front of the mirror.
Hello. Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This right away to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. And he had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his
Roll
true
backwards.
back. And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. Oh. I'm out, but I just thought, what am I going to do? But anyway, I know, but I'll be all right, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a carers association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling, and I think that's an important outlet for her.
I can't fix my hair up.
Brush it.
I have.
No, you haven't, Pa. Brush it properly.
Watch.
That's not brushing it. It's not even black. How are you not black? This is brushing.
Yeah, but ow!
You have to brush it. It's called brushing.
Don't. You're hurting my scalp.
Oh, shut up. See, that's what it's called
Yeah,
brushing.
but I don't want it flat like that.
It looks nice. It was sticking up before, like the Mad Professor. You look like the Nutty Professor.
You are the Nutty Professor.
It looks nice now.
Yeah.
Mr. Maury, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. Okay. And Miss Maury, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always a possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay. Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from, let me show you the letter from the hospital.
Yeah.
So
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
you take your time. Do you want a glass of water or anything?
I'll have a glass of water, please.
Let
Thank
me get you
you.
a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There we go.
Oh, thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today. Yeah. And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said, the big C, to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
because I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, if you've got any more questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor.
Okay.
If anything happens to me in the meantime or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come on. Come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Len.
Okay.
Thank you very much for your time and your concern.
No, not a problem at all,
appreciate
Mr. Rory. These are the most important times.
Thank
and
you,
that's
Dr.
why that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. But then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
I didn't win the lottery.
I still like you though.
Yeah, I'm not going into the I'm not going to go to the meeting.
Okay.
If my patient comes in, will you just let me know?
Okay.
He said he might come. He said he'd come back at 1 o'clock.
Which patient's this?
Mr. Murray.
Okay.
So, let me know when he gets here if he does.
Hello,
Hi.
Hannah. Come and have a seat.
Thank you.
How are you? What's happened?
I don't know, my eye, and I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started like, it felt like there was something in it. And I've spent ages putting my finger in it, which obviously hasn't helped. And then I thought it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some like fluid, it was been really watery, but then it seemed like there was some creamy coloured.
Discharge.
Yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was just literally, my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So...
There's nothing wrong with it, is there?
Well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and
Yeah.
sore.
Does it look irritated?
No,
Honestly, not at all.
not really, no.
Oh, I was spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No,
Okay.
I agree. It feels like a bit much
It does feel like a bit much.
because your eye essentially looks completely fine.
Yeah.